Systematic newborn examination. Before commencing the exam, pre-read the maternity handheld records to gain the maternal family and obstetric history. Note the type of delivery, APGAR scores and sex and weight of the infant. Review the feeding history and check if the infant has passed urine and meconium. The equipment you'll require to complete the examination includes a neonatal stethoscope, an ophthalmoscope, a pen torch, oxygen saturation monitor if it's part of your trust policy, the red book, appropriate PPE, and find a warm, quiet area with reducible lighting to complete the exam. Gain consent from the parents prior to completing the examination. General observation of the infant include: is it awake or asleep? Is it warm or cool? Check the infant's temperature and only proceed if the temperature is above 36.5. To carry out a head-to-toe examination, undress the infant and to carry out a general visual examination. Examination of the head, noting the size and shape. Is there any moulding noted? Look at the fontanelles. The anterior fontanelles between 1.5 and 5 centimetres. It's usually about 2.5. Does it bulge? This may be indicative of infection or increased intracranial pressure. Is it sunken? Maybe a sign of dehydration. The posterior fontanelle is normally about 1 centimetre. If a third fontanelle is felt, it may be a sign of trisomy 21. Note if there's any swelling, bruising or abrasions around the head. Examination of the eyes. Examine one eye at a time. The shape should be almond shaped. Are the eyebrows and eyelashes present? And is the pupil reactive to light? The sclera should appear a bluish white colour. Shine the ophthalmoscope through the pupil to elicit the red reflex. If it's absent, it may be a retinoblastoma or congenital cataract. Note the position of the ears. Is the helix level with the eyes? Is the helix fully formed? Examine the crus, the inner rim, to make sure it's present. And is there a fully formed pinna on each ear? Note if there's any skin tags and is the meatus patent. Has the newborn screening been completed for the hearing? Is the nose symmetrical and straight, and is there symmetrical nares? An asymmetrical nare may be a sign of a cleft palate. Check the philtrum above the mouth. Is it fully formed? A flat philtrum can be a sign of fetal alcohol syndrome. Is the upper lip bow-shaped? If there was any facial palsy, it may be seen when the infant cries. Check the lips, the colour, are they moist? The tongue, is there any macroglossy? And finally, with a fingered glove inside the mouth to examine. Feel inside to ensure the soft and hard palate are intact and note if there's any teeth present. You could check the suck reflex at this stage as well. And then visualise with a pen torch to confirm. Check the tongue for any macroglossy, and is there any tongue tie noted? You could check the reading reflex at this stage by stroking the infant's cheek. It should turn towards you. Examine the neck for any masses or webbing. Note if there's any torticollis. Is the infant able to move its neck to both sides? Palpate the clavicle, feeling for any masses, fractures or pain on either side. Examination of the arms includes palpating down each arm for any crepice. Count the fingers and the thumb and note if there's any extra digits. Examine the fingernails to make sure they're all present and that there's no signs of infection. Have you noted any webbing between the fingers? Examine the palm of the hand to check if there's 2 palmar creases. 1% of the general population can have a single palmar crease. This is called a simian crease and can actually be a sign of trisomy 21. At this stage, you could check the grasp reflex. By placing your finger on the palm of the infant's hand, it should close its fingers around your finger. This would be the palmar grasp. Examine the chest, the general appearance and symmetry. Is there any engorgement? Count the respirations for 1 full minute at this stage. Palpate across the chest to feel where the heart rate is loudest. It's usually around the left nipple. Feel for thrills. It'd be like a cat purring. This would be indicative of a grade 4 murmur. Feel for heaves by placing your hand across the heart area, and if it's present, it will feel like your hand is being pushed away from the chest. This would be indicative of a left ventricular problem. Listen to the heart using a stethoscope. Initially at the mitral area, which is mid-clavicular line, 5th intercostal space, and count the heart rate for 1 full minute. At the tricuspid area, which is 4th intercostal space at the left sternal edge, listen for a further 30 seconds. At the aortic, mid-clavicular line, 2nd intercostal space, right sternal edge, listen for a further 30 seconds. And finally at the pulmonary area, mid-clavicular line, 2nd intercostal space, left sternal edge, listen for a further 30 seconds. It should sound crisp and clear, like a lub-dub sound. At this stage you may do your pre and post ductal saturations if it's part of your trust policy. If you have a positive test, complete a 4-limb BP and an ECG. Abdominal examination. Visualise it. Is it round and soft? Palpate for any masses. If the liver is palpable, you should feel 1 centimetre or less. Is there any birthmarks or rashes? Look at the umbilicus. Is there 3 cord vessels? Is there any hernia around the umbilicus and is it reducible? Note any inflammation of the skin, and if the infant has not passed urine, check is the bladder distended at this stage. Finally, you can check for the femoral pulses if you haven't already done so at the cardiac check and palpate the inguinal canal for any herniation. Hip check. Check the leg lengths and symmetry and the abduction are equal. For the next step, examine one hip at a time. On a firm surface, stabilise one hip and with the other hand carry out Barlow's manoeuvre by placing 2 fingers over the greater trochanter and the thumb on the inside of the thigh. Adduct the hip by bringing it towards the midline and apply a gentle posterior pressure to the knee. This detects a dislocatable hip. Ortolanes is when the knee is flexed to 90 degrees, abducted by folding the leg outwards, and if it was dislocated, it will go back in at this stage. You will feel a clunk. The skin creases are no longer checked as part of the nightly exam, and with all risk factors, refer even with a normal exam. Genitalia examination. In males, testes examination. Can you feel both in the scrotal sac? If bilateral undescended testes is noted, an urgent referral is required. A unilateral undescended testes is reviewed at 68 weeks. Observe for any hydrocele. This is a swelling of fluid around the testes and it usually dissipates within 24 hours. Examine the penis shape. Any curvatures noted, and is the foreskin fully covering the glans? A hooded foreskin is indicative of hyperspades ventral displacement of the urethral meatus. In females, check the external genitalia for any swelling, skin tags or discharge. Examination of the legs and feet for any rashes or masses. Is there any talipes and is it fixed? Note the shape of the foot, count the toes and check again are the nails present and there's no infection around the nails. Check if there's any extra digits and note the colour of the feet. Examine the plantar creases are present, and at this stage you could check the plantar reflex by placing your thumb in the middle of the ball of the foot. The infant should curl its toes around your thumb. Babinski's reflex is when you release your thumb and the infant should splay its toes. To examine the back, lift the baby and turn it over. At this stage you could check the step reflex. Lie the baby on its abdomen and you will find it will turn its head automatically to one side. Observe for any birth trauma, rashes or birthmarks that you haven't already noted. Feel down the spine to make sure it's straight and note any sacral dimples or cleft. With a pen torch, can you visualise the base? And then check is the anus patent. You could then check the Moro reflex by holding the baby supported in one hand. You can allow the infant to fall onto your other hand, catching its head. At this stage, what should happen is it should splay its arms out and bring them back towards the body. This would be a normal reaction. You can now redress the infant and return it to its parent. Remove your gloves and apron and complete your hand washing. Give a full explanation of the findings to the parents and record any results. Complete any referrals as required and thank the parent for allowing you to complete the examination.